There's a lot happening with New Jersey's child welfare system. We want to help you make sense of it and share our story. This is DCF on the Air.
This is DCF on the Air, and I'm Jason Bukowski. Today we're going to be talking about, the whole podcast is talking about the transformation of New Jersey's child welfare system. And one of the foundations of that is really basing our decisions on data, on evidence, to make sure that we're making informed decisions about the services that we provide, the supports we provide to families and children. Joining me today are two of our individuals working within the department that really help shepherd our data strategy. I say data, but we're going to get into that in a minute. But I'd like to introduce them and let them introduce themselves. Go ahead.
Sure. Hi, Jason. My name's Amanda O'Reilly, and I'm an assistant commissioner here at DCF over our analytics and systems improvement work. So what does that mean? That's 3 offices within the department, and that is our research and evaluation work, all of our data and reporting and analytics work, as well as our quality improvement work. And we have with us here one of our directors of one of our offices to talk about what she does. Pam?
I'm Pam Lilliston. I'm the director of the Office of Applied Research and Evaluation at New Jersey's Department of Children and Families, as well as DCF's scientific advisor. So I oversee our Office of Applied Research and Evaluation. We're an office of about 30 people who are charged with conducting research and evaluation studies, really aimed at understanding the needs of New Jersey's residents, as well as the impact, the equity, and the implementation of our services.
So before we get started, and thank you so much for joining us today on DCF on the Air, I want to conduct a little bit of a brief survey, informal survey. I haven't run it through the advisory board or anything like that yet. But is it data? Is it data? Let's turn to the experts. How do you pronounce this?
Definitely data.
Definitely data. We had our own little internal debate about this before we came up here. And I think you can go either way, but we're both clearly in the data camp.
Yeah, data camp. Okay, yeah. Perfect. So I'll know to say it the right way. I'll sound more intelligent than I actually am. But thinking about how the department has used data, I almost said data there, it's weird. It's like it's where it lands in the sentence. Sometimes it feels more comfortable to say it a certain way. Or
either one's acceptable.
Okay.
So you can be comfortable.
Okay. But going back through the history of the department and using data to really inform a lot of the different things that we've done, really we've set this structure up going back to really the start of the department. I'm wondering if you can talk historically how data has sort of informed our transformation and our reform efforts of New Jersey's child welfare system.
Sure. I definitely think using data has been, one of the priorities from the very beginning of the child welfare reform. I think from the very beginning, our goal was really to put data in the hands of the people doing the work. So very early on, we invested in things like software for staff to be able to understand what their performance is, what's going well, what's not going well. And that happened right from the get-go of the child welfare reform. And so access to information and data was one of the very first priorities of the reform. I think one of the other, priorities was teaching people how to use the data. See?
There you go.
There you go. I did that for you, Jason. And so it's funny, you planted the seed and now it's in there. So really teaching people how to use the information that we're providing them. And so we created lots of different opportunities for people to become comfortable with using data. And so we created programs like using ChildStat, where people had to come up and present their data. We created programs like the Managed by Data Fellows program. And so I think over the course of 20 years, we've had lots of different iterations of this. But I think we've prioritized teaching people how to use data and really prioritizing creating space for people to get up and present their work using data. And I think that reinforces people's skills and the accountability to use the information that they have access to. And I think the third thing around data that we've really prioritized is transparency to the public. We want to make information available to our staff, but we really also want to make data available to the public to use as well. So we've made a lot of investments in putting data on our website. We produce data monthly on our performance. We also have partnered with the Rutgers University School of Social Work to produce the New Jersey Child Welfare Data Portal, where we put a lot of information out there about our child welfare services, about our children's system of care and our children's behavioral health system. So we're really invested in the use of data, creating a data culture, putting data out there. It's one of our, core values here at DCF.
Yeah.
Yeah, I think what's been really exciting for me, just kind of building on this, is that, this commissioner has really reaffirmed our commitment to evidence as really a cross-cutting value within this department. And we've been able to really leverage the data infrastructure and the data culture that's been created over many decades, really, at this point, to do increasingly sort of complex research that's really focused on understanding the impact of the services that we provide to New Jersey residents. Are they working for the people that we serve? How are we implementing them? Do we need to course correct and do things differently so that we're getting the best possible outcomes for children and families? I think the other piece of it has also been around leveraging what others are doing. So I think that we have really looked to the evidence elsewhere to understand what are the programs, what are the practices that work for children and families and the people that we serve, and really implementing them within our own system as well.
Sure. And I think, when we talk about, first off, that child welfare data portal is immensely helpful. In my work, when I'm talking to reporters, I can pull up the data and really kind of report in real time. Additionally, I do that with the commissioner's monthly dashboard to kind of showcase, what are some of the statistics, what are some of the key indicators of our success as a system. But something Pam had said about looking at sort of best practices from outside of New Jersey. When I think of data, it's really sort of an import-export kind of thing, right?
Mm-hmm.
Not only are we ingesting data from other jurisdictions and learning about the work that they're doing and incorporating some of the practices that are really showcasing how they're being utilized to support families, but we're also exporting our own data, and that's a way where we're able to really influence child welfare on a national stage. I'm wondering if you could talk a little bit about New Jersey as sort of a leader nationally in data. How are we using it? And, what are we hearing from the field as far as the information that we're putting out there about our practices?
Sure. I think I feel very fortunate because about 2 years ago, our commissioner really invested in this area for the department, and she created analytics and systems improvement. And part of that investment was to dedicate resources towards our data communication strategy and our data translation work. And so that meant really hiring staff and putting dedicated resources into this space to really help us to take our work to the next level. And I think we wouldn't be able to do all of the great things that we're doing without that commitment and those resources. And so Pam's going to talk a little bit about some of the things that we are doing, but all of that was part of our larger strategy to share what we're doing with our stakeholders, both internally, our partners here in New Jersey, and then a wider community across the country.
Yeah. So, I think it's really exciting to work for a department both where we're really doing innovative work, but also where we have research, where we're able to learn about that work and share it nationally, right? So I think we have done work that we've been lucky to showcase on the national stage. I think one of the projects that comes to mind is very early on in Commissioner Byers' administration, she really highlighted kinship placement as a priority for the department when children cannot remain safely in their homes with their own parents. And as part of that effort, our office has been partnering with the Division of Child Protection and Permanency for really over 5 years now in order to understand, what are the barriers to kinship placement? How can we help to facilitate kinship placement in New Jersey? And one of the projects that we engaged in was we conducted a survey of our child protection and permanency staff to understand what are their attitudes towards kinship placement, what might be getting in the way, and then what's really working for us, right? What's contributing to children being placed with kin. And I think what was really neat about that survey is that we were delving into the culture around kinship placement at a time where not just New Jersey, but really nationally, there's been focus on this issue and sort of a commitment to placing children with their relatives. And so through that work, we've been able to publish the results of the survey, the key findings that we found, both in the national literature and to present it at national conferences. And what's been really neat is that we've had researchers, we've had other child welfare agencies approach us and say, tell us more about how you did that. How did you do that data in order to target strategies to increase kinship placement rates within your state? So that's been a real success story for us. I think another example, more recent, is that we've been partnering with the Children's System of Care around their implementation of the Zero Suicide Framework. So the Zero Suicide Framework is a model that's really focused on multi-level prevention strategies for suicide within healthcare systems. And our Children's System of Care has taken this model and really applied it in a setting that's different from where it's been applied before. They've applied it in a youth-serving system that's also non-clinical in some areas. And by studying this intervention and the adaptations that we've needed to make for it to sort of work within this setting, work within this population, we've generated learnings that I think can really be applied to other systems to prevent youth suicide more broadly.
Yeah. And I think, going back to the example that you used around kinship, since 2021, I've got this embedded in my brain because it's telling the story of DCF. 47%, I think right now, as of March of this year, 47% of youth in out-of-home placement are placed with kin. That represents almost half of all youth in out-of-home placement, but it's also the majority of youth in resource placement. When we're talking about telling the story of the department and engaging people in sort of our transformation journey, having those numbers to kind of call back to and use, it really showcases that we're on the right track. It's not just this is our hunch that we think this is the way to go, that this might work or it might not work, but being able to use data to reference that success and tell the success story, I think has been incredibly useful. I'll note that as we're recording this, we earlier this week just finished our budget hearings for the year with the New Jersey legislature. That statistic made its way into our conversation because we know that, as we're talking to people who maybe don't have a child welfare background or a data researcher background, that being able to bring those statistics out, it really makes a believer out of the people that we're talking to. So as we think about the communications aspect of it, and this is a relatively new aspect of what ASI has been doing, from when we launched ASI, but I'm wondering if you can talk a little bit about some of the specific activities that are ongoing, particularly like the DataBite Insights and that work to really talk to the evidence to someone like me who's not a data researcher.
Sure. So I think, again, very early on, I think Pam and I sat down to talk about we're producing all this information and we're really presenting that to a very small audience of executive leaders here at DCF, and that we really needed to create a targeted dissemination strategy. And I think as we formed, we're very lucky here in New Jersey to be able to have an internal applied office of applied research and evaluation. And so as that office was formed, Pam really took this challenge on and ran with it with her staff and really started innovating in this area to create a lot of new products for the department. So Pam, do you want to talk about some of the cool things happening in ARE?
Yeah, so I think, right, like data's no good if it sits on the shelf. We all know that, right? And so I think, like Amanda said, we had developed this data infrastructure. We'd hired all these talented researchers, and we were producing so many great findings. We're like rolling in findings. And I think what we realized is that they were reaching a much smaller audience than they had the potential to reach, and that far more diverse audience, much larger audience, could really benefit from what we were learning here at DCF. And so we really decided to get very intentional about dissemination. I think a lot of what we see in research and a lot of what people might think of is sort of long, boring reports where maybe there's really important findings, but they're hidden under lots of pages and lots of jargon. And so we really took on the challenge of thinking about how can we get data to people in a way that is digestible, accessible, dare I say, exciting to them, and that they really want to engage with it in a different way. And so I think there's a couple things that we really think about. So the first thing we think about is timing. So with regards to timing, what information needs to get to who within what time? And so we really focus on what are the decision-making timelines? When does information need to be in people's hands in order to make a difference? I think the other piece of it is format. Most people aren't going to respond to a scientific journal article, a long report. And so getting creative about the way that we get data into people's hands. So for us, that can mean research briefs, it can mean presentation, it can mean little social media posts. But I think one of the more exciting initiatives that you mentioned is our Data Bite Insights that we rolled out this year. And so for the Data Bite Insights, really our focus was getting data into the hands of our frontline workers, right? DCF has thousands of frontline workers who don't often have the opportunity to engage with the data that we are producing. And so we wanted to get them information about the services that they are referring families to every day and that we have really helpful findings about. So we created these short videos. They're about 7 minutes. They always feature a researcher in partnership with a program partner. And the goal is to really tell the story of the program, not just about what the program does, but what are we learning about the program? What's its impact on families? What outcomes are we achieving? And we found that they've been really well received, right? Lots of people are watching with them. People are commenting and engaging with them in a different way. So we've really considered that sort of a success for our office.
And thinking about those partnerships with programmatic staff, that's really part of the format of the Data Bite Insights. But also, I'm wondering if you can speak to some of the programmatic partnerships that are currently happening within the department. I'm thinking of like programs like NJ4S, Family Connects New Jersey, where there is a huge evaluation effort to really kind of showcase outcomes. And I think that's going to evolve over time as we get more longitudinal data. But I'm wondering if you could speak a little bit to how we're really enriching the programmatic work by the evaluation that we're doing on the back end.
Sure. And so I'll start and turn it over to Pam. So I think we have prioritized in DCF strategic plan to deliver service excellence to all of our constituents here in New Jersey. And what we know from the literature is one of the key ways in order to do that is it takes a lot of complex partnerships in order to deliver service excellence because people are complicated and programs are complicated. And so our staff here in ASI work together with each other, but they also work together with our sister offices across the department. with our program partners, with our external stakeholders, oftentimes with our family partners, to be able to construct evaluations, to be able to construct data systems, to be able to understand what's working, what's not working. And so it's this complex array of partnerships that help us to deliver on our priorities and to achieve equitable outcomes for families. And so Pam's going to talk a little bit about what we have going on with NJ4S.
Yeah. So I think, Jason, you brought up NJ4S. I think that's a great example. So for folks who don't know, right, that's a service that's really focused on promoting mental wellness among youth in New Jersey. And I think that's important now as much as ever, right? I think we've seen mental health as a real challenge among adolescents in the state. And so for us, when we rolled out NJ4S, we were really committed to understanding how we're implementing the program, as well as the outcomes and the impacts of the program over time. And so for us, we've really partnered hand in hand with the Division of Family and Community Partnerships in order to evaluate this program. And we do it in a couple ways. So we have quantitative data, so that's the numbers, right, that we collect from our data system. That helps us to understand, what is the reach of this program? Are we getting this program to the schools who need it the most? Are we getting it to the youth who need it the most? Are we reaching their parents, their families, the teachers? And so we've really been able to use that data to help us understand, are we reaching all the folks that we should be reaching with NJ4S services? But then we also have the qualitative data. We go out into the fields and we interview people. We observe NJ4S sessions. And from that, we're able to really tell the story behind the data. We have teachers, we have parents, we have youth who've told us about the impact of NJ4S on their lives, who've told us about what a difference they've made for us. And so I think that's really been the power of being able to evaluate and collect data that speaks to the story of this program and really what it's doing for New Jersey's children and families.
Yeah. And I think NJ4S is a great example too, because you were involved at the very start. You helped develop the needs index that showcased where we needed to focus our energy as far as engaging schools in the highest needs areas. You developed a methodology for that. Then the program gets launched. Now you're doing the evaluation work. You're helping us to evolve the program to make sure that, if something's not working, that we're able to course correct and make this program work for the most people possible in the state of New Jersey. So I think that's a great example of how not only are we setting up programming based on research and data, but we're also pivoting off of that when necessary to really respond to whatever evidence is coming out of the field.
Yeah, I think that's absolutely true, Jason. And I think, as the program sort of shifts over time, right, and it becomes more developed, right, we're excited to continue researching the program and to really understand, what are the population level impacts that this program is achieving in New Jersey? And so we're hoping to continue to evolve the research and evaluation as the program continues to grow in the state.
Thinking about some of the other upcoming work of your team, I know that one of the big areas where you're going to be providing a lot of support is through the implementation of New Jersey's Family First Act Prevention Services Plan. Can you talk a little bit about what that entails and how it's going to be a benefit to not only the department as a whole, but also the people that we serve?
Sure. So just a brief overview for the audience, right? Our Family First Prevention Services Act is a shift in our federal funding towards prevention services for families, which historically would have only funded foster care services. And so I think we are a little ahead of the curve here in New Jersey, where we've had a lot of these prevention services in place for a long time. And so, but now we'll be able to draw down some federal dollars to help support the work we're doing. With those federal dollars come a lot of accountability metrics attached to it, in terms of requiring a lot of data collection. I almost said data again. You got me, Jason. Okay, so requiring a lot of data collection and rigorous evaluation requirements and continuous quality improvement requirements that is specified as part of the law. And so I think here in New Jersey, our staff, our team really positions us very well to be able to comply with all of those requirements. And the first part of that process is really standing up all of our IT infrastructure that's required for us to be able to collect all of that really good information and data that we need. I did that for you. And so we have here at DCF our information management strategy. That's a multi-year process where we're really investing in our data infrastructure. And so that will really allow us to be able to, we've made a lot of investments in our infrastructure on the child welfare side to allow our staff to be able to document their work and understand their performance. And right now we're making those similar investments on the provider side. So we'll be standing up new software and new applications for our providers to be able to, track their work, understand their performance so that we're really able to understand the impact of those prevention services the same way we're able to track and understand the child welfare work that we're doing. And of course, to be able to comply with all those federal requirements.
Yeah, I think, as Amanda stated, the Families First Prevention Service Act really requires implementation of programs that have been proven to be evidence-based. And I think the beauty of that is that we know from the research when we implement evidence-based programs at scale, we can really impact family and child outcomes at the population level. But you have to implement them well, right? And so for us, our role is to really track ongoing implementation of these evidence-based services to make sure that we are implementing them as planned, as we should, with high quality, and then also tracking outcomes over time to make sure that this is an intervention that's really working in our population. And if it's not, do we need to track and adjust a little bit? And so really that's the focus that we have when we think about the Family First Prevention Service Act services.
Great. I'm wondering, so over the course of, your careers analyzing and evaluating data out of the Department of Children and Families, are there any times where there's been surprises where maybe you had a hypothesis, using like scientific words, but you had an idea going into it, what you were going to see, and maybe it was a little bit different as opposed to what you were imagining?
Yeah, what comes to mind is thinking about the kinship survey work that we shared. I think early on when we had really identified kinship placement as a priority for the department, there was an idea that we really need to educate staff about why kinship placement's important. We need to talk to them so much about the benefits of kinship care. And I think what we learned from our survey when we really asked staff what are their attitudes towards kinship placement is that they were bought in. They really appreciated kinship placement. They saw the benefits for the kids, right? They worked in the field, right? They see it every day. But what was challenging for them was really more around the policy and the process. And so I think that was surprising to us, number one, and allowed us to kind of pivot and focus our strategies on policy and process. And I think when we did that, we saw over time, when we measured attitudes again 3 years later, that attitudes towards policy and process had really improved over time. And we think that that's a large part of what helped to shift our kinship placement rates and improve them.
So it wasn't really a cultural challenge. It was more of like an infrastructure challenge.
Yeah, it seemed to be.
We had to have the policies and practices that went along with what everyone really knew all along, which is that kinship placements reduce trauma, ensure better outcomes for the children involved, help reinforce reunification, all of those things. So
yeah, the attitudes were there. They believed in it. We needed to reduce the administrative barriers. Yeah.
And I think that's just a really good example of where we really want to collect the best data possible to be able, and specific as possible, to be able to understand really complex problems so that we can develop really specific solutions to get us to the results that we're looking for. So if we went off and tried to just train people on why kinship is a good idea, we would be missing the mark. right? And so I think we're doing this all over the place. I think kinship is one of our quality improvement efforts here at DCF, but we have so many of them. And so I think our goal is to be able to, we have a whole continuous quality improvement effort happening here at DCF. And our goal is to really identify the problem in as detailed of a way as possible, and then to get underneath the root cause of why that problem exists, and to develop really intentional solutions to address the root causes to get us to the result. And that's a perfect example of one of those cycles.
Yeah, absolutely. Thinking ahead a little bit, I'm wondering if you can share a little bit about what's on the horizon as we really get more sophisticated in our use of data, maybe putting out a pronunciation key. But what are we doing to really inform the data focused, and data-informed mindset for the department?
Yeah, I can think of a couple of examples. I think one, in 2025, I'm excited to talk about that we're going to be launching in partnership with you all a new website to launch our new interactive Commissioner's Monthly Report. So we're going to be sunsetting our PDF version of our static dinosaur report that's been up there. While maybe helpful, not as helpful as it could be in the modern day. And so in 2025, we're going to be launching a brand new, as part of our data modernization effort that I talked about. We really want the public to be able to engage and interact with our data on the website. So that's going to be coming this year, which I think is really exciting. I think the other area that we're really focused on right now is launching our quality improvement work with our providers. And so that's launching this year. And so that's a systematic way for us to be looking at data with our providers and going through that process I just talked about across many, not all, but we're starting with a select group of our partners out there in the community. To be using data, making improvements, and continuing a similar process that we've been doing with our internal staff for 20 years.
Yeah, we're doing so much amazing work at DCF. And when I think about what I'm really excited about, it's really about continuing to build the rigorous evidence around that work, and not just what the impacts of our services are, but also what the cost effectiveness of our services are. I think we know intuitively that when we invest upstream, we invest early on in supporting children and families, it results in cost savings to public systems. And so I'm really excited to continue to sort of build the evidence around what that looks like.
Great. Well, thank you so much for all you do at ASI to support the amazing work that's happening at the department. Really, without that evidence base, a lot of this would be guesswork. And by really giving us that basis of this is what the data says, you're helping us to put out the best programming possible and really improve outcomes for all families throughout the state. So thank you for all you do.
Thank you for having us.
Thanks for having us. Yeah.
So with the idea of data in mind, looking ahead to next month, we're going to be joined by individuals to talk about reunification. In New Jersey, looking at the evidence, we have one of the lowest rates of out-of-home placement in the country, the absolute lowest rate of out-of-home placement in the country. But for those individuals, those children and youth that are placed out of the home, our goal is always to reunify the family. And I believe that I'm sure talk about this next month, in over 60% of cases, we are able to do that. So that's a good thing. We're able to reunify and reunite families. So tune in next time for a conversation around reunification. And on behalf of my producers and the Office of Communications and Public Affairs at DCF, thank you for tuning in.